This ECG has irregular RR intervals, right? So these are not equally spaced. So if we were to count them up, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, heart rate somewhere in the 60s. The rhythm, it is irregular, it is chaotic, but we have these deflections right before most of the QRS complexes that make it most likely some kind of supraventricular initiated rhythm. But the P waves are down in 2, so they're not really sinus. The PR interval is a little on the short end as well, and for the most part these waves do look pretty consistent. There are a couple that don't look quite the same, but a lot of them do. And so what this is most consistent with, in my opinion, is that there is an additional focus somewhere in the atria that is generating all of these waves, an ectopic focus. So I would call this an ectopic atrial rhythm. And then on top of that, we've got premature atrial contractions. So I think pretty clearly that's what's going on here, because we don't see that same wave that's downgoing in lead 2 before this, and this one comes in early. So I would call this clearly a PAC. I think that's what's going on with these ones as well, although it's a little less clear. You know, this one still is downgoing. This one's downgoing as well. If you compare it up here in V1, you know, this wave, I shouldn't say P wave, it's not coming from the SA node, but this wave and this wave look pretty similar, but this one looks a little bit different here. Axis, up in 1, up in F, we're good to go there. Intervals, I already said that the PR here looks a little bit short. The QRS looks a little bit wide, but it's not quite 3 small boxes, I don't think. So if you wanted to call this an interventricular conduction delay, you could. The other thing to note is that the QRS here, 2, 3, and F, has this reciprocating pattern to it here that sometimes is called a fractionated QRS. We're not exactly sure if that is a pathologic phenomenon or not. It may be associated with electrical bad outcomes, specifically sudden death. But if it is, it's a pretty mild association. Ischemic changes, so we do clearly see T waves that are inverted here in 3, in F, in V5, in V6, so inferior and lateral T inversions. And then we also do meet some criteria for LVH. Specifically, if you measure the S wave in V1 and the R wave in V5 or V6, you're going to get over 34. So that's consistent with left ventricular hypertrophy. So in summary, I would classify this as having an ectopic rhythm with PACs, left ventricular hypertrophy, and non-specific ST wave abnormalities.